Welcome to the Suicide Monk, and my name is Britton Day, and today we have Alicia Shipman with us today, and she works with Evolve MD, and it is a company that is it newly started? Is it fairly 7 years now? Okay, so you got past that 5-year mark of establishing it, and that's usually the measure. But how's it? Yeah. How's that? How's it going for you guys so far?
I was just talking to somebody from that works alongside me, and we were talking about, because I started with the company 6 years ago, so about a year after entrepreneur as this co-CEO started it. I mean, they're doing such great work. It's amazing. And I do feel like, I'm not just saying that, right? I'm honored because every day I get to do the work that I feel like I was put on earth to do. It was quite an honor. I don't think a lot of people can say that. So I feel so extremely grateful, and they've done great things. I mean, they're businessmen, the guys that started this, but they really, truly do care, and they're doing great things. Now we're in Florida. We extended all the way to Florida, and we are in Colorado and New Mexico, in Utah. And before, when I started, we were just in Arizona, and just like a tiny little company, right?
Wow.
So they've done big things.
What was their initial? Because from my understanding, not all of them are MDs. They're not doctors. They invested in this company to. What was the purpose? What was their dream?
Oh, really, and the neat part about this, and kind of when I started with the company, it just sold me. Eric Osland, our CEO, he encountered a lot of problems when his dad was trying to access healthcare and mental health care, and his dad was really struggling with a lot of things. And Eric found that it was so incredibly difficult to access the healthcare system and the mental health care system. There was not a lot of coordination of care. The primary care doctor wasn't talking to other people, and he was just so frustrated. So he thought to himself, like, there's got to be a better way, right? And so he has an entrepreneur mind. So he thought, hey, I'm going to try to fix it. I'm going to try to make it better. So that's kind of how it was born. And I mean, I was hooked when he told me that. Like, I feel the same thing. So
Yeah.
it's a great story. And I think he continuously, and everybody else in the company connect to it on a personal level, because it is so like the important work that we do every day. I mean, we can help improve lives, save lives, make the mental health care system better. And you can't do better work than that. In my opinion, it's awesome.
So what are you guys doing different than the normal system that we have in place?
So great question. So we've found in a lot of research, and Eric through his research found that when people are struggling with mental health, right, and especially to suicidality, we find that most of those patients are going to their primary care physician first. So a staggering stat is 45% of those people that commit suicide would have visited their PCP within a month prior to their suicide. Staggering, versus the 20% of people that would have gone to their mental health provider. So we kind of wanted to go to the source, right? So if you can go to your PCP and have your therapist in your PCP office working alongside your primary care provider, making it easier to get seen, easier to get medications because we have site consultants on staff, making it easier so they don't have to go see a psychiatrist if they don't need to. They don't have to step outside of their primary care doctor. Right? They trust their primary care doctors. And so it takes away a lot of that stigma and that fear of like, no, I have to walk into this mental health office, which nothing against that, right? But we just want to break down any barriers and make access to care easier. So a lot of patients tell us this, like, I wouldn't have gone to therapy, but since you're actually have a physical therapist not physical therapist, the mental health therapist in the office, in the primary care office, they can walk right out of their appointment with their doctor, right in with the therapist, and it makes it very easy for them to access mental health care.
So you try to schedule that back to back if you can, if somebody's interested in doing that.
And we can even do it same day. So neat part, and I love about my job is I get to work with a bunch of clinicians across many different sites in Arizona. I've seen it where a patient comes in, they're seeing their primary care, they're tearful, they're upset, they're scoring high on their depression screening scores, and the primary care office doctor can walk right over to the therapist and say, hey, can you see this patient right now? They're really struggling. They will get them in to see them. We can do same day visits. So the access just makes it, because when you're struggling with depression, anxiety, you don't want to wait 3 months to be seen. I don't want to wait 2 weeks.
Yeah. And it's hard to move from one doctor to the next when it's hard to move, period. So, you pick and choose your battles and what is better going to serve you. And that's your primary care is going to give you the medicine more than likely, more than times than not. So.
Absolutely. And so we're also providing education to the doctors too. They're learning a lot about mental health from us because we're one of the most comprehensive collaborative care management providers in the United States. So, let alone Arizona. So we're providing a lot of education to them so we can go to them and say, hey, doctor, right, if this patient is coming to you asking for this medication, instead of saying, no, I won't do that, asking us, okay, well, what would your psych consultant recommend? And how would I prescribe this? And what would that look like in conjunction with mental health therapy, right? So they're learning a lot about do some cognitive behavioral therapy with this patient and along with me prescribing meds. And I think the doctors feel better being another option rather than just prescribing meds. Right? Like, oh,
I hope so. Yeah.
I can prescribe somebody to not only take this medication, but they can actually see a therapist who's going to help them along this journey.
Right. Yeah. I'm struggling with big pharma right now. That's because I've been on the meds and a lot of times it was just numbing. It was, it just kind of blocks the feelings. So you don't go down, but you don't go up either. So and I always found that disturbing and difficult. I don't know if you know anything about my story, but I was highly suicidal, and the medication did block those whatever receptors for me to not actively seek suicide. Like the suicide ideology was kind of numb. But as soon as I quit, I was like, I know what's coming. And it did. And it came in full force. So then the question becomes, how do we combat that? Because big pharma should be a short-term solution to what's been a long-term problem. And I think that's what we're struggling with in America right now. It's not just talk therapy is not doing what it used to. We were having an influx and flood of mental health problems in this country for various reasons. So how is Evolve MD addressing those kinds of things? Because our mental health has definitely increased since 2020 and the pandemic.
So there's something called delayed grief, right? Where in 2020, we saw suicide rates go down a little bit, but then right after in 2021, they really increased, right? And since then, they've continued to increase along with rates of depression. And that happens, right? Where we see that because people are really isolated. I mean, like you said, there's a lot of different things going on. It's not just the isolation, the continued isolation, right? But it's many different things, the high stress in the jobs, the way that we're working people at their jobs, right? The way that we are dealing with current economic stressors. Like there's many different things going on. So we at Evolved MD try to be there, meeting the patient where they're at and giving them whatever resources they need, right? So it's not just therapy. It's not just medication, but maybe they do need to get connected to a support group in the area. Maybe they do need they need smart recovery, right? Because they've been not seeking treatment for so long, it actually turned into a struggle with alcohol or other types of substances. So we're trying to, we have care coordinators that help and call with the patient to make the appointments, to make the appointment with the support group or this group over here. So we definitely provide a lot of wraparound services and follow up with those patients too. Our behavioral health manager in the office will follow up with a patient. Hey, did you make, because I think a part of it's accountability too. Did you actually
It
make
is.
an appointment?
Yeah.
Do you need help getting transportation to that appointment? Because maybe that's the barrier. So I really work a lot with my clinicians. What are the barriers? So if these patients aren't coming back, let's talk about the barriers and reach out to them again. Are they having trouble coming in because they feel embarrassed? Like, we need to figure out those things. And I'm so passionate about it. I mentioned Eric's story, but I'm really passionate about it because my father died by suicide when I was 15.
Right.
So and I also struggle with big pharma too, because he was found with a lot of meds. He was on medication, right?
Yeah.
And now he was not getting therapy, but I really do believe if we had something like this in place at a primary care office to help somebody, that suicides like that could have been prevented, right?
Yeah. Yeah. And I know we started off on the business side of things, but I do want to hear your story. I want to hear how
Sure.
how that event affected you and kind of shaped those years of your life to bring you to this point now. And then how you have processed that over the years and moved and navigated through that.
And I really, when I saw your podcast, I'm going to be a listener now, by the way, because I didn't
Thank you.
discover it until now. And so I followed it. But I'm at huge. I think what you're doing is so amazing, because I think there needs to be more people like you bringing awareness, right? And sharing your story. So thank you for doing that.
Yeah.
I know that's incredibly difficult, but I think I was so young when my dad died, right? And I think I was 15, and that's really a formative year, right? My frontal lobe wasn't developed, right? If you look at it like scientifically, it was a really transformative time in my life to lose I was very close with him. We were best friends, I felt like. So he disappeared. It had a huge impact on me, right? For a long time, threw myself into being busy and being the best student and doing all these things without completely understanding what had just happened and realizing, like, delving into how does that make me feel. So I'm thankful enough that my mom knew enough that I was struggling, that she needed to get me into therapy. So I was actually fortunate enough to have access, right? And I know that that's also a problem, and I'm so thankful that I did have access to mental health care, right? That's a privilege. I had the option to go to it. I went to it every week for a long time and then continued in college. And struggled. I'm gonna lie. There was a lot of years of trying to figure out if I could have done something different, if it was, trying to find someone to blame. Like, there was a lot of struggle there. And just the grief, and then trying to have people understand that even though it's been 2 years ago, ripple suicide effect, right? That, it ripples throughout the family and individuals for years and years and years. I mean, I'm now 37, and I still am dealing with it, right? Meaning, like, the grief is
Yeah.
still present at times, some days. Now it's gotten easier to cope, but when that happens, it completely affects the whole family. And so that's why I'm big on suicide prevention, right? If we can prevent that person taking their own life, but it also will impact the whole entire family system, right? So personally, it's a struggle. I went to therapy for a long time. I went to therapy in college. And it was finally in college that I decided to, I got to make meaning out of this, because I had no idea what I wanted to do with my life. And I'd been in therapy a lot, and I feel like I was starting to cope with it a little bit better in healthier ways. And then I decided I wanted to be a therapist, so that we're a social worker. That's actually my background. So, clinical social worker. So I wanted to do more. Like, if I can advocate on a bigger level, and not just even do therapy, but do bigger things, like with a company like this,
Mm-hmm.
that's why I kind of went into the work that I'm doing. be able to do this every day, to provide any sort of awareness. It's just like it's a motivation for me to come to work. I think what a lot of people don't understand is even though, people come in and talk to us about it, their children died by suicide. Like, it's not something that grief after a year is just like, well, it's better. And like, we should be better. I mean, it pops up at unexpected times. So we have to learn how to cope with that and deal with it and have a support system. Like, I have a great support system. Husband understands there's going to be some days that are harder than others. And there's going to be some triggering events. I have a great mom that is so supportive and understands. So the support system is so important. And people in my workplace, like, they know my story. So let me know, like, hey, how are you doing? Or did you get, like, just the great. So a support system is huge. Sorry, that was a long-winded answer.
No, you're fine. Do you understand? Do you have a better understanding of why your father did it?
Do. And I think I'm so glad you said that and asked that, because I think in the beginning I didn't. And I was for so long, I was searching, like, why, right? Like, that everybody wants to know why. I think now, as a therapist, but also as a daughter, I understand that he was just like, he needed to escape the pain, right? That was it. Like, he was in so much pain and the meds weren't helping. Never told anyone. I didn't know. My mom didn't know how severe it was, right? Nobody knew. And that's why they call it, it's like the invisible illness. Like, nobody knew at work. Like, that's the thing that always struck me whenever I talked to his friends. Like, he masked it so well. So I think I finally got an answer that, like, it was an illness, right? And that perspective changed, because at first I was like, why would he do that? It's an action. Like, why would he take his own life instead of die by suicide, right? Like, to me, that was a huge shift. Like, oh my gosh, my dad had mental illness, right? And he lost his life to that, not because he chose, but because he was in so much pain. That was the only option. And his brain told him that that was the only option. Now, that's not true. He had other options, but his brain, and I understand that now, he was in so much pain. It seemed like the only option, and he didn't have capacity to realize how much it was going to impact everybody around him. And I think he just needed to escape the pain, like what immense pain somebody must be in to want to leave this earth. So that's kind of how my empathy has shifted, and it's helped so much in working with patients too. Like, gosh, I get like tearful just thinking about that, because to sit with somebody in that immense amount of pain, it's really hard, but it's an honor to be able to work with people and let them be so vulnerable to let you in on it.
That's a huge honor. A buddy of mine says that nobody alive knows how much pain somebody's in that's dead, that's taken their life, basically. And we really don't. Well, I do. I mean, I've walked to the edge. So, and I think a lot of people have, and for some reason there's resilience that continues to happen, and that gives hope. So that's why I thought this was so important, to expose myself in this whole thing. But I also flipped the world off and was like, I don't care what you think anymore. Like, you can't take anything from me that's not already been taken. So now it's a whole different story. I have life. Like, my life is very, very different than what it was 6 weeks ago, 7 weeks ago. I had a paradigm shift that incredible.
So I didn't think that was the only option. But I think healthcare providers and mental providers are trying to figure out, like, how did you get to that paradigm shift? And like, what was the thing that we can prevent this more? Right.
Right. Yep. There's several things that transferred me. One of the big things for me, like my birthday, my aunt died and we buried my aunt on my birthday. It affected me in a negative way for 44 years. This year I realized nobody loves her more than I do except for her mother, because I get to celebrate her every year. And that's the paradigm shift that's happening consistently with me, because I get to now experience life. I get to now be an observer of life. I now get to suffer. I now get to enjoy the suffering and get to navigate these things that used to send me over the edge. It's a mental switch. It's a mental flip that you have to do that says, I'm not going to believe society and what it's told me anymore. I'm not going to believe yes, my story is true. The things that happened to me are true. They're not my definition. Being molested, being beaten, well, I'm not an abuser and I'm not a molester, so that is not my identity. That was my identity. That was my story, because that was the victim part of who I was. I'm no longer a victim. I'm no longer at the mercy of other people. I am now formidable. I am now beautiful. I am now good. I realize exactly who I am at the core of my spirit. And that's what we're trying to get back to, is that thing that we came into the world with before everything was stripped away. And that's the true spirit of who we are. If we can fall in love with that, we can have confidence and allow others to fall in love with us, and then transfer that in many, many different ways. So
yeah, and I identify with that too. Like, right, just this woman who her dad died by suicide, right? Many other things like that doesn't define me. And if I did let it, that would probably not be here, right? And I wouldn't be as have the happiness and the capability to have a family and all those things, right? Now, it informs some of the decisions I make, but it definitely doesn't define me. So I think that's a big paradigm shift there.
that now I've got this paradigm shift. I don't know if that's what your question was, but it's kind of,
yeah. No, I think, and I love hearing that, because I think that, when people have been able to, get past and kind of overcome some of those, especially when there's really suicidal thoughts that are persistent and they can't escape them. I ask patients all the time, like, tell me what was the difference? What made the difference? Because that can only inform us better to help other people, right?
Mm.
So I think it's so interesting to hear from your perspective, and kind of what has helped you, and like you said, it wasn't meds. It was this shift in the mindset and kind of like the perspective on everything.
Yeah. And, one of the big days. So as I'm walking towards my death, I'm very lucky to be here. I've had, since February, I've probably had a dozen people step in my path unintentionally that have prevented what I wanted to do.
Okay.
I also have a very heavy spiritual life. So that was a huge part for me, because I live in loneliness, and that's what I rely on a lot, is my spiritual life. So the big thing was, the big blocker for me was, a friend of mine knows a professional hockey player that bought a ranch, and it's a psilocybin therapy ranch. And in February, I ran into these guys, and they're like, come to the ranch. I'm like, well, they're like, come to the ranch in April. I'm like, well, I'm dying in March. Sorry, boys, And so I agreed to it. And I'm just like, I don't really give a shit if I make it or not. Like, but I end up making it in June, end of June. Yeah, everything got canceled. A lot of things messed up. A lot of inadvertent things happened, but also a lot of blockades, and the timing was perfect. I went through one hero's dose for a weekend, and with 18 people, And I went to fight for my life. It was my last Hail Mary. I was like 99% sure it wasn't going to work, 98% sure someone there, and 99% sure I was taking my life within a few days. It worked. It freaking worked. Like, I'm like suicide, grasping for the thought of suicide. It's like a distant, thin smoke now. Like it's not embedded in my body anymore. It's not wrapped within my soul. That darkness, that rage, that ugliness, all of it's, I'm empty. I purged it in a weird, I don't even know. All I know is I'm riding this train as fast as I can. Like my fuse got lit.
It was that currently, because I'm really interested in psilocybin and alternative treatments too. Do you think it was the dissolution of the ego that helped a little bit?
I did have an ego death, but I've worked on myself since I was 18 actively. Like I checked myself into a drug and alcohol treatment. I was sober for 17 years. I was involved in the church for 15 years, actively, like youth groups, 2-3 youth groups at a time. I was baptized 7 times. Like I was actively seeking out a new life, but I could never grasp hold of it.
Mm-hmm.
So I think my spiritual life had a lot to do with it. The psilocybin it was a catalyst to allow me to see myself differently. So I am no longer this ugly, rageful, mean, whatever. I don't even know what that is anymore. But I do know that I'm good, I'm formidable, I'm powerful, I'm kind, I'm loving, I'm so much. And that's what it did. It made me realize how beautiful of a person I am. And that's who I want to be, so I can give that to other people. And then, as long as I stay full, I can carry a lot of weight with other people. I can walk with a lot of weight, not carry a lot of weight. And I can walk with a lot of people in the darkest places because I know what it's like to be there.
So, yeah, and I think it's so great. And hopefully we'll see more policy change that allows more psilocybin treatment or ketamine or other therapies, right? Because I do think we're seeing have you ever read the book, How to Change Your Mind?
Yeah.
Yeah.
Caroline Leaf?
That's a great,
Is it Caroline Leaf? No, that's How to Switch on Your Brain.
No, How to Change Your Mind. He's a journalist. It's going to escape me now. I can send you the link to it, but he's a journalist, and he talks about his depression, and he actually documents his treatment, journeys through psilocybin treatment. And he does ketamine, and he also does the toad.
The toad poison. Yeah.
The toad poison. But it's really interesting, and it kind of talks a little bit about, all of those and what it's going to look like in the future. But yeah, I'm really interested in all of that and its benefits, because a lot of people they're resistant. The meds don't work for them, right? The antidepressants don't work for them. And I understand that. And like I told you, have a personal connection. Like my dad tried all of them, was on with all of them, and it didn't help, So there was other things that could have helped and needed to be done. But again, I don't think he felt like he could share. And I hope now our society is a little bit more open to mental health treatment and people feel less of a stigma. But I think especially about suicidality, it's really hard for people to share.
It is very difficult to share, and it's very difficult even with your friends. I've lost a lot of relationships because of that suicide ideology and being open with it. I've lost a lot of friends. People don't know what to do with it. They don't know how to talk about it. They don't know how to have conversation, and they don't know how to just walk with people and not try to change the path, but just love them. So
and just told stories.
They just don't know how to do that. Most people don't. And even though they have thought about suicide, most of them have had some thought of it. They don't fully understand the torment of somebody who's highly suicidal. Like they can't possibly. Yeah.
Yeah. That's a statement. So, yeah. And I think it makes people uncomfortable right? And so they don't want to talk. They don't know how to talk about it. Like we said, they don't know
Right.
how to address it. And so then it leads to more isolation. Like, oh, I just opened up and I was vulnerable to this person. And now they won't hang out with me and they won't ask me how I am. Like, should have I not? Then it brings shame, right? Now, I don't know if you're a fan of Brene Brown. She's a social worker, but she talks a lot about like the internal shame that a lot of us hold.
Mm-hmm.
And so there's a lot of shame in that too. And a lot of shame that comes like as a symptom, maybe causes of, suicidality.
Well, it's an extreme emotion
Yeah.
generally. And you find at least the people that I've spoken with, the majority have had long-term trauma of some sort. Not all, but a lot of them, more than not, have these long-term childhood traumas that really triggered or was the start of that self-shaming that really creates this, the what?
That like, I'm not good. I'm not good.
Yeah,
I'm not,
like, and
that
it's that overwhelming, it's a flood of, and it's unstoppable almost. It's like there's no combating it with just words. A lot of times there's heavy practice that has to take place, and most depressive people don't have the energy to do heavy practice like meditation because I'm already in my head all the time. Why do I want to go there again? Well, it's to learn how to compartmentalize and deal with things individually so that you can navigate the ladder a little better instead of, walking up wet steps all the time.
And I think that's one of the keys, right? If we can make people feel welcome and take away a lot of that shame, like, hey, you're sitting here in the office, like, let's talk about it. Like, let's get into it. Let's talk about it. Let's make this something that's not uncomfortable and let's work through it together. Like, I'm holding space. I'm walking alongside you through this, right? So I try to really help my therapist kind of be able to hold space like that, right? Instead of, my gosh, we need to call crisis and we need to do, right? Like,
well, that was my next question is, how do you deal with somebody that walks in and says, I'm suicidal today?
Yeah.
I want to die today.
Yeah. Great questions. In Evolved MD is really good and I love this. Our clinical support staff supports us in this. Really good about making a really good assessment, right? So we're accurately assessing. Like, okay, if you say I want to die today, let's talk through that. The therapist isn't going to immediately call 911 or call crisis and you have to go inpatient right now, right? Like that may not be what they're saying at all, right? Like, let's hear the patient. Let's spend the time, ask the questions. Okay, so what does that mean to you? Tell me more about what that feels like and what that looks like, right? So does that mean that you think about it all the time? Does that mean that you actively have a plan? Like, did you buy a gun? Are you going to do this tomorrow? Like, let's talk through all these things. And can we make a safety plan instead, right? Can we actually just like work together and say, hey, are you okay with meeting with me in 2 weeks or meeting with this other therapist and your doctor? And you will promise and commit to that. If you say yes, then let's do that and let's get to that next step. And then the next step and the next step. So my purpose, especially with my team, is I try to keep people out of hospitals. Now, I know that's not a popular opinion, but I do think that inpatient treatment can be really traumatizing.
Oh my gosh.
And I think in a lot of ways, it can be unhelpful, right? It can actually make symptoms worse. I've had a lot of patients. Now, granted, there's been some that have had good experiences, but I do think it's more traumatic than that, right? Having to go in the ambulance and then people strip you of your clothes that you're wearing. You can't have your cell phone. You can't have your belt. You can't do any of these things. You're going to be isolated in this room. Like, I'm a big fan of that. So I always tell my team is on the same page as me, right? Like, let's try to keep them out of the hospital, keep them as safe as possible. So what does that mean? Let's work with the family members, right? If they have an emergency, contact their best friend and they stay with their best friend. And their best friend makes sure that they don't have any weapons in the home, any means to actually take their own life. And they'd be a support. So we kind of try to surround them and do all of the other things before ever having to look at inpatient treatment. Now, I know that is unpopular, but it's sometimes.
So what about the in-between? What about the middle of the week when they've come to see you and it's pushing the weekend and that those feelings set back in and they don't have an appointment till next Tuesday or Thursday?
That's hard, right? We always tell them, we line them up with supports, right? So you can, of course, text your therapist. You can reach out to them because they're going to be working. They're going to be there for you. And we have available like check-in appointments. So that's really neat. I don't think a lot of people know that we do that. They're like 15-minute appointments that are virtual. So they can be a phone. Yeah. And I love that. So let's say if you work in the middle of the week and have an appointment for a week, they could text their therapist and say, hey, can I do a check-in? And I just really need to talk. And that we give our therapists windows of time, like 15-minute increments throughout their day or half an hour increments to make these emergency calls or check-in calls. And I think that helps. Like, so I heard my therapist say they utilize those so often, and patients do too, right? And that's really nice. And a lot of times, if they have, if they have a plan, their insurance plan where they pay co-pays, right? Like it's a non-deductible plan, that check-in call doesn't even cost enough, right? So they can just call their therapist, talk it out. Their therapist can provide support and resources, and then they feel better enough to get them on to the next week, right? So we also provide, so I love those check-in visits.
Yeah, that's awesome. That's exactly what my question was. I wasn't sure if that would be something that would be in place, but I'd love that you guys do have that because there's torment comes very often for people like me. It's not just I'm good and then I'm good for a week. It's you might not be good for until you get back the next week. I mean, it's just, it's months upon months upon months of torment. And then you get little avenues of a break and you're just waiting for the rug to get pulled because you feel too good. I mean, it's a vicious cycle.
Yeah. Yeah. And I think, ideally, I would love it if our therapist could see them multiple times a week, right? But they can't. We're bound to, I think I read a little bit about your podcast. You understand that, we're going against a system that's broken. Like the insurance system dictates what we can do and how many visits we can do per week or per month. And so we really try to make the most of what we have and what we can do. So I'll give you an example. This is why I love this company and why I do the work that I do is we had a patient that just exited the hospital, inpatient stay, right? And he had already maxed out his number of visits with the therapist. Well, the therapist calls me, is like, he needs to see, we have to. And I said, sure, go ahead. Let's do it. You need to see him. She had an hour visit with him. That may not get reimbursed, but was it the right thing to do? Because this patient was actively suicidal and just got out of the hospital, was in a really vulnerable state. Yeah, it was the right thing to do. And our team will always support me. They will never come up and be like, why did you do that? Right? They're always going to say, was it the right thing to do by the patient? Yes, it was. 100% they'll stand by me. So I like being supported in that, but I can, if I know if it's good for the patient and it's right for the patient, I'm going to do it. So
that's awesome. I mean, I'm really glad to hear that you guys have a system in place that is not in place in the regular medical field or even in the mental health field. Those follow-ups generally don't happen from a therapist when it's outside of, because they're seeing so many damn people all the time. They have no time to do anything but document what they've got and see the people that they have on their list. And that's one of the things that I realized, that people are like, why don't you go into therapy? Why don't you become a psychologist? I'm like, I don't want to be bound by those things that don't allow me to have a relationship with the people that are struggling. I want to be in your life. I want to walk with you in your life. That's a therapist can't do that. There's separation. There's laws that bind them. And if they are highly suicidal, they have to report it. And I'm like, I'll just sit with you. As long as it takes, I'll sit with you. And as a therapist, I couldn't do that. As a
Yeah,
life
there
coach, I
are.
could.
Yeah, absolutely. You could. I know. And that is the hard part, right? Like we're still mandated reporters as
Hmm.
therapists. You know, like
Hmm.
we have to, if you have but I train my staff and I really think we all do to be very careful about that. Like, does that mean they actually have a plan, a means, and intent today? Or is it just this feeling like they want to escape the pain and they're in so much pain today? Well, maybe we can do some other interventions, right? Like instead of having to send them to the hospital. So I really think that's been helpful to a lot of patients that'll come back and say, you know what, like that was just a really low day. And I'm so glad because I got through it. I didn't need to go to the hospital. That was something where I managed it with my doctor, with my therapist in an okay way. Right. So we try to make everything, we're trying to be really trauma informed too, right? Like how can we make it less traumatic, less stressful, less difficult? Because everything is so hard. And when you're extremely depressed, everything is already like getting outside of your bed in your house is hard enough. Like I'm
Hmm.
not trying to make it more stressful for you.
Right.
It's difficult, right?
So on the medical side, what types of services do you offer? Is it regular medical doctor, like your family doctor type? Okay. Yeah.
Yes, so we partner with regular primary care doctors. Like today, I'm at an Optum clinic, but we also partner with Honor Health and we partner with Evernorth and some other big banners, another big one too. So they all have primary care clinics and we partner with them and embed therapists in their primary care. So the medical piece of it
Wow.
is your family doctor, like your primary care doctor.
That's fantastic.
Yeah. So you can go and maybe you're dealing and struggling with a new diabetes diagnosis. Well, that's a patient we can see too, right? So if they're struggling with it, the doctor just diagnosed them with that. The doctor can say, hey, if you are really struggling, I get this is a big diagnosis or a cancer diagnosis, come see your therapist. Give it a
Right.
try, see how that is. So the doctors have really appreciated it. And I think we always say we come into also, we're not only helping the patients, but we are helping the doctors too. Cause like you said, they're seeing so many patients and they are overwhelmed and they are exhausted ever since COVID. It's gotten worse. And I think we can be like a relief valve for them, right? Because many times they're struggling. If a patient comes in talking about their depression, they care so much. Usually primary care doctors, they care a lot, right? Like
Hmm.
they went
Right.
into it because they care a lot about their patients. So they want to feel like they have the time, but they don't. They don't have half an hour, 45 minutes to talk to their patients. They have 10 minutes to see you, right? And so for them to be able to say like, but I can have somebody see you and I have it right here in my office and I trust them and I know that they're going to help. It makes them feel better about what they're doing too and relieves some of that pressure from them. So it's cool that we get to do both.
One of the coolest doctors that I ever came across was Dr. Painter down in Indianapolis. And I can't remember the name of the hospital, but he was my brain surgeon. He had a doctor that worked for him. And she spent half an hour with me talking to me. And then he came in with her and spent another hour with me talking to me. Very, very uncommon because the first physician that I went to spent 5 minutes with me, said, I'm going to cut you from ear to ear. We're going to take out the tumor, slap you back together, and you'll be good. And Dr. Painter went through every single detail of what he was going to do, the procedure, what I was going to feel like. He knew exactly what was going to happen. So he was really well educated is my point there is like, but he also educated me as a patient. And I read on your website that you don't take as many patients because of that very thing, that the influx of there's so many, but you want to have quality of care over quantity of care. Did I read that correctly?
Yeah. So, and I think we continuously make changes to make that better, right? Like I'll give you some historical perspective. So when we started, because, when it's a brand new company, we're just trying to figure things out. And I was a therapist seeing 12 patients a day, right? It was shorter visits, but it was a lot of patients. So they took the feedback, understood that was for too many a day, and then lengthened the visits and made it so we have 8 patient slots a day, but we usually see, because of no-shows, right? Like 5, 6, 7 patients a day. And that gives the therapist enough time to do their own self-care, to talk to the doctors, to do their documentation. Because that's another thing, and I love about this company, is we don't just care about the patients, which is really important, but we also care about our employees, right? So it doesn't do the patient any good if we're like, hey, therapists, see 1 million patients a day and be burnt out, and then you have to leave. Because then those patients just lost, created all that rapport, and now you've left. That happens in high turnover over and over. So we really try to focus on retention efforts, right? Trying to really keep them here. But that's not just for us. It's so that patients don't have to deal with that, right? So we can provide better quality care to them. And we do have a lot of great data coming out about our statistics, when patients are seeing us, and then their return rate, how much they're returning. But when they do return, what's their rate of depression when they're doing their PHQ-9 GAD screening scores, right? So one of the staggering stats I just saw, because it's really, again, we're still relatively 7-year-old company, but we're gathering all this data, which is so great. So across all of our clinics, all of our states, about 84% of patients are seeing a reduction in their depression screening scores after just one visit. So that might mean a point or two, but that means they're coming down. That's a great step for mental health, right?
Yeah, it is.
So I'm a data geek. I love those numbers and those things. So we're getting more and more of that because we want to make sure we're doing a good job. We're not just seeing the patients, but are they actually getting better? Are they actually coming back to us? Are they graduating with success? Are they dropping through the cracks? So they take a look at all those things with real seriousness.
Yeah, that's wonderful. I think that all that's important to really understand what's effective. And, getting those high percentages, you're like, okay, this is working.
Yeah, something's working.
Do we add something to it? Does it, how can we improve even upon that, or at least put more tools on the toolbox and ensure that percentages keep going up?
Yep. Keeps getting better. And I think that's why, our owner, and I like to say this too, it's how can we be disruptive to the healthcare system, especially the mental healthcare system? Because you said, it's clearly not working. There's the rates of depression and suicides are only increasing. Why is it not getting better? Right? What's happening here? So he constantly questions the status quo, which I love, right? Because it in turn
that's awesome.
creates a culture of questioning, why do we have to do it this way? And so currently, I think he's constantly talking to the insurance companies, trying to battle with them about why are we doing this way? This doesn't make sense. We need to be reimbursed based on better quality outcomes for our patients, not just seeing a patient, but are they getting better? Are the statistics saying that they're getting better? They're improving? So there's a bunch of work being done, constantly about making it different. Let's do it different. It's not working this way. Let's do it a different way and see if that works. And if that doesn't work, we're going to try something else. So we pivot really fast, which I do really enjoy, because we don't just do the same thing it's not working. We're going to try something else for our patients. And if our patients are complaining about this thing, let's try something else. Right? So I do
So how do you get feedback from patients in that regard? Do you send out lists or surveys? Is that?
Yeah, they have patient surveys and patient feedback at certain partners of ours, right? At certain customers, so that we can't, we ask questions about wait time, right? So is it too long of a wait to see our therapist? How is the online platform that we have? Because we have it's really cool. It's called NeuroFlow. We have a tool to give all patients, and it's free to them to use and free to them after they start therapy too. It's really neat. It does check-ins, right? So you can check in, do screenings how am I feeling today? What's my mood? But they also have a bunch of resources on there, like videos about anxiety, videos about depression, videos about how to cope with panic attacks. So yeah, we invested in that. It was like 2.5, 3 years ago.
And that's an app?
So, yeah, it's an app. It's
NeuroFlow.
called NeuroFlow. Yeah.
Excuse
And
me.
I think we're fine. I don't know if the public would do it. And I think you can access it from just being, public, but we give it to all of our patients for free. And it
Awesome.
helps us too, because they can enter their screening scores on there. They can journal on there. They can do a bunch of stuff in there. And
so they can share that information with you if they choose to.
If they want to. Yeah. So some of our therapists, if the patient wants to, again, they can select, but if the patient wants to share their journal entries, they can with their therapist. So that's another way. Like, okay, if midweek I'm not feeling good and I want to put a journal entry, and my therapist can see that. If I choose to let them. If they don't want to, they can toggle that option off. But that's been a really great tool, because it gives them, when they come into therapy, maybe today's a better day, right? Because that happens, like, oh, today's a good day, but now I'm here on therapy, but 3 days ago it wasn't. They can go back and look at the journal entry and talk about, like, what was your mood then? How was it like? Because when you wrote this, it sounded like you were really feeling hopeless. And so that's been a great tool as well.
Yeah, that's awesome. That's really cool. What are some of the big things that your company deals with? I read about the transgender community. There's it seems pretty heavy on the website. Like you have an influence in that, or a medical influence in that community. So did you want to talk about that a little bit?
Yeah. So I think the thing about Evolved is they're very accepting, right? All communities, all aspects. So if you come in and you're seeing a doctor, maybe you're thinking about gender transition, right? That you need support in that, you could see our therapist for support in that. And they're not going to diagnose you with, something's wrong with you, like a gender dysmorphia. That's not the issue. Is you want support in transitioning maybe to a different transgender. How can we provide supports in the community and help you deal with the anxiety or depression around that transition? Or maybe you are just, coming into the community and you found out that you are interested in anything else other than, like, maybe a different sexual relationship, right? But you don't know what that means. And it's hard because your family doesn't agree with you and you don't know how to talk to your doctor about it. But you can talk to your therapist about it. So our therapists are really supportive of the LGBTQIA community, and making sure to also partner and get them to the right places too. Like, if they need additional support groups, we're going to connect them to those community support groups, because there's great people and nonprofits in the community doing great work too, right? So we're also trying to connect and help in that respect. I hope that kind of answered your question.
Yeah. I just didn't want to skip over it, because it seemed like that's one of the things that your company not focuses on, but advocates for.
Definitely. Yeah. It's a lot of advocacy. And I think because we also know that there's high rates among those people who in LGBTQIA community, right? So I think providing
high suicide rates.
Yeah, exactly.
Why is that?
Providing support. There's a lot of studies or statistics around this, but as a therapist and working with our therapists in the offices and working with those patients, I think a lot of it is not feeling accepted, right? Not feeling like they can be accepted by their family. Can they be accepted by their friends? Can they be accepted by the community at large? And, like, what does this mean? Or them not knowing, like, feeling isolated. So a lot of it is very similar to what other people feel too, right? But they might feel more isolation because they don't have any friends who are transitioning to male, right? Or they don't have any friends who are bisexual or, gay. They don't have that. So they don't know what to do, and their parents don't approve of it. So I think it is a lot of, like, this internal struggle of, like you would say, once you let go of what society is telling you and the shame that can be brought upon that. It brings a lot of freedom, but I think a lot of people have struggle in that. Like, how do I let go of some of that and be okay with loving who I am, whoever that is, right? Like, if it's gay, lesbian, transgender, anything like that, like, how do I be okay with just loving who I am instead of focusing so much on what society thinks of me and what others think of me? So I think that societal pressure and like not belonging is a huge weight on some of those, those who struggle with depression and anxiety.
So you had said that well, and maybe I misunderstood this. This is not a mental illness.
Oh, with LGBTQIA.
Yeah. So how is suicide a mental illness if that's not?
So mental, can you explain the question a little bit more?
Well, because oftentimes, I don't think of suicide as a mental illness.
Mm-hmm.
I think it's a trauma and lack of coping skill. Teach people how to cope. Teach your kids how to cope. Teach them how to navigate hard things. Don't just wipe their knees off of them and pick them up and hug them and wipe their tears, like lend a hand so they can stand up, wipe their own knee off, and then nurture their emotion and help them navigate that. But oftentimes we don't do that. We don't do that with adults either. It's like me, people didn't want to help me navigate. They didn't want to give me opportunity. They didn't want to show me there was a different way. It was just, reject and push away. And then, well, he's got mental issues. Well, yeah, I mean, because I don't know how to deal with anything. So we're essentially in the same playing field as a transgender person that doesn't accept themselves, that because they're focused on what society thinks. How is that any different than me wanting to take my life? Because society doesn't accept me. It's rejected me. It won't accept the fact that I'm suicidal. Has nothing to do with my gender, but it has to do with my emotional state. But so does transgenderism, and so does, like, it's an emotional state. So I was lucky enough that I had a full switch of learning that I'm valuable, and what society has always told me or what the evidence said is not necessarily true, because I was looking from the outside to validate my inside instead of looking inside and looking at what my true nature is and validating myself for saying, I'm okay with who I am. I love who I am.
So I think it's hard to talk, and for me, it's hard in absolutes, right? Because like you said, there are going to be some people that absolutely have a genetic component, right? Like they have a genetic component that makes them more predisposed to suicidal ideations and depression in general. And we know that from a lot of scientific backing and research, right? And there are some people who have had trauma that absolutely informs how they feel and how they think and how their brain functions. But I'm a bit of a scientific geek and nerd. And there's a lot of brain scans that show different activity in the brains of those who struggle with depression or anxiety, right? And I know that there are a lot of correlations between the differing amounts of serotonin and dopamine. Like there's a lot to that. Now it's hard because I can't look at a brain and say, this person has depression, right? But there's some scientific backing to that. So I think we can't say it's absolutely in everybody. It looks just like this and it was caused by this, right? So what I'm saying is, I do think, like in my dad's case, I do think he was predisposed, and I think it was a lot of genetics, but I think it was a little probably of trauma too. So do I think it was? And it might have something to do with he was not taught how to cope well by his parents. Absolutely not, especially in that era. Like he was in his 50s when he died. So I think that both can be true. And I think that he did struggle like that he struggled with depression, which I do think is, now stay with me here, is similar and equatable to like a diabetic diagnosis. And I say that because I do think there are some differences in the brain versus a person that has depression and somebody that doesn't, right? So I do think, like, just as if you were diagnosed with type 1 diabetes, like, it is a medical condition that is happening to your body, and we can cope with it and give it medicines in certain ways. Same thing. Now that's just my perspective, right? I do think that there are a lot of things that happen in the brain that give people with depression a certain disadvantage, right? Now we can cope out of it. We can get medication to help us. But I think then it takes away some of the stigma. Like, I'm not saying that it's their problem. Like, they caused it. It's their problem. They have to deal with it, right? Like, I do think there's a large component of, like, the way our brain functions and genetic components to it too. But what I'm saying about the LGBTQIA community is not there. And I said, it's not a mental illness. What they're dealing with, right? The trauma from that, the stressors from that may cause depression. And some of those people may be more genetically predisposed to depression, anxiety, things like that. Does that really make sense?
Well, yeah, but it
Just
still
some
is, there's not enough long-term data
Mhm.
like you have with depression and diabetes or suicide ideology. So
Mhm.
there's, with the transgender community, we're saying, well, I'm not, but you're saying that it's not a mental illness, but we don't have, it's surrounded by mental illness. It's surrounded by those symptoms of mental illness, which I would argue so is suicide ideology. And I would argue that, that's my suicide ideology is not the same as my diabetes because I'm type 1 diabetic.
Yeah.
They can prescribe me medicine for my depression, but they can do that with the transgender community also. I guess I'm not saying that it is a mental illness or it isn't. I'm saying I don't think suicide ideology is a mental illness. Think from my experience and what I went through was trauma, and mine is trauma induced. When I was 10 years old, my mom tried to commit suicide. It's the message that says when things get really hard, Britain, you can check out, you can quit. That's the message that has long-term haunted me and has been an option for me. A lot of people haven't experienced that, so that's not their option. That's not their. And I'm not arguing with you. That's not what I'm saying. I'm just saying, as I look at myself, I'm the most sane suicide person I've ever met in my life. And it's logical. It was, I mean, you couldn't argue with the logic behind why I wanted to take my life. There's just no way. I mean, it was all true. The difference is now that I see my story differently. My narrative to my same story is very, very different. Is that mental illness? Well, I don't know.
Conversations, because I think they need to happen too, right? Like, okay, well, really, because it is so subjective, right? Like, why can you go to one therapist and they say you have PTSD? You can go to another psychiatrist and they say, actually, you have schizophrenia, right? Like, because we can't take your blood and say you have bipolar schizophrenia, right? Like, we can't do that. There's no test. We have tests, right? We have evaluations and things, but it's very subjective. So I think that it's hard. I think those conversations need to continue happening. And you're right, absolutely, that a lot of trauma is, you can see that, and it's very prevalent in a lot of people who struggle with consistent and constant suicidality, right? And trauma does cause, but I would argue a little bit here in my research in dealing with children in ages like 0 to 5, 0 to 3, that when you do have a lot of trauma, when your frontal lobe isn't quite developed yet, it does cause the brain to form differently. It causes
Yes.
different synapses to change. It causes the firings to go off a little bit differently. Like, everything functions a little bit differently.
1,000%.
Whether or not, like, and I'm not big on labels, so whether or not we call it a mental illness, what I know to be true is that people who are struggling with depression, anxiety, suicidality, right, need help. They need the tools. They don't know because their parents didn't teach them. And so they need to be walked alongside, given the tools, supported, taken out of isolation. Like, those are the things I know to be true. And so, I don't like to focus on the labels. That's why I don't love the insurance and having to label things per se. But like, sometimes when we give it a name, like depression, then it helps the patient realize, like, okay, this is what is happening. Now I can take action steps to treat it or to work on
Exactly.
this or to cope with it. Right. So that's kind of a little bit about my kind of, the view on or my perspective on it.
Right. And
Yeah.
I agree I'm not a big label guy at all, but when I identified that I had social anxiety, I was like, oh my gosh, now I get to do something about it.
Yeah.
I didn't realize that's what it was. And that label actually helped me identify something that every time I go into public, I don't have to worry anymore. Like, I can go through these few exercises that I struggle with, but they're automatic now. And I can walk into a place confidently that now I'm not being looked at by everybody and studied and judged and all this stuff. And now I'm like, I can go in with a smile, and if anybody's going to look at me, they're going to see something very different than what I portrayed once in my life. So it's a very different persona and perspective for me.
Yeah. So that's, I'm not, again, we're much more than our labels, much more than the social anxiety, much more than the depression, but it can help, and it can help people put a finger on it rather than like, just feel like something's off or something is not right. Right. And so sometimes it is a relief, but sometimes people also don't like that when they get to.
Yeah. For sure.
Yeah.
For
It's
sure.
hard because when you're in the business of humans and working with humans, right, there's going to be a whole spectrum. So that's what I always tell my therapist. Like, some people will like that you're telling them, okay, I diagnosed you with this and this is how we're going to, some people won't like, right? So we have to work in all this spectrum. Like, how do we work with all of those people? Because we are in the business of humans, and it is really hard, but we're constantly trying to like meet them where they're at. What does the patient need? What are their needs and wants? What are their goals, right? Like, so meet them there rather than like telling them what to do. Let's meet them there and walk alongside them and develop a treatment plan that's going to work for them, because it's not going to be the same for every person. And that's okay.
Yeah, for sure. No, it's wonderful. Is there anything else you'd like to discuss or tell us about the company that before we close this out?
Just say as general, but I'm sure I'm going to be listening to more of your podcast. But, I think I'm so big on like, okay, what can we do if I'm currently struggling with suicidality and really depressive thoughts? Like, I think it's just making sure that people know that there's a lot of resources out there. You can go see your primary care doctor. Hopefully now some people know that. Like, if you're in the honor health system, the donor system, Evernorth, now PC, you can go right to your physical health provider and ask for therapy, and they can help you get it rather than saying like, phone number on the back of your insurance card. But also make sure, that people are not isolating, like
Physical health or mental health?
Physical health provider.
Okay.
Yeah.
Okay.
Because they have to have a primary care doctor in order to see our therapist.
Gotcha.
That's the one caveat. But yeah, so I would say making sure that people know that they can do that, but making sure they know there's other things out there too. Like, there's 988, which can connect them to like somebody to talk to over the phone. There's a lot of different supports that a lot of people don't know. So I would just say add into the consideration.
Nice. Well, thank you very much. I appreciate you being here. Thank you for being on the Suicide Monk, and we'll see how this goes. We'll put it out there. Love what you guys are doing. So
thank you. I appreciate the opportunity. And it's Britain, right?
It is.
Okay. Nice to meet you. I so appreciate it. And I'll be a listener.
That sounds great. Thank you so much.
You're welcome. Bye.
All right. Bye-bye.